Dr. Swapneil Parikh, he's a physician scientist, Dr. Sameer Gupta, a cardiologist, both of them right here to answer every question that you would have as far as vaccination of kids is concerned. First, let me start with Dr. Gupta. Appreciate you taking the time out. Firstly, first question on everyone's mind, every parent's mind is whether my child is eligible for vaccination. Who are the children specifically, perhaps with comorbidities, who should consult a doctor first before getting their jab?
Thank you, Chetty. And I would like to applaud the efforts of the government, first of all, that we are finally getting into vaccinating everyone. And this is just the first step where, some teenagers are being eligible for vaccinations. And it's also important to understand that this is the first thing before we go back to kind of normalcy. The schools are going to start opening, and we're getting data from across the world that even though the Omicron variant is mild in children, the mild of a big number, a small percentage of a very big number, is still a big number. So it can kind of overwhelm the healthcare system. Every child should get vaccinated who's eligible. Upwards of the eligibility criteria right now, and they should all get vaccinated, especially children who've got comorbidities. They should be vaccinated. If you've got asthma, if you've got
are there any kids, Dr. Gupta, who do not make the cut, maybe immunocompromised or any kind of specific kids with certain medical conditions that you would recommend consult your doctor before getting vaccinated? Any concerns at this point of time as a doctor?
If you're on blood thinners, then yes, you may want to talk to your doctor, but nothing per se, nothing strikes out unless you have some allergies. Then that is one thing you may want to consider and talk to your doctor if you should or should not get the vaccination.
Right. Hold on right there. Dr. Swapneil Parikh, there are many parents who have big question. Is the vaccination safe for my child? What is going to happen in the long run? Yes, we know the side effects in the short run, a little bit of fever here and there. Long run, what will happen to my child? What would you like to tell them? How would you like to allay the fears of the parents watching in right now?
The vaccine that's being rolled out for pediatric use has been used in over 100 million adults without a safety signal. In addition, generally with vaccines, and I'm not suggesting that's the case with this vaccine, but generally with vaccines, it's the short-term side effects we worry about. Long-term, they're very safe. And there haven't been any serious short-term side effects with this vaccine. We also always have to think about risk and benefit. So when we talk about the side effects of vaccines, we also have to remember, why are we giving them vaccines? We're giving vaccines because COVID-19 and the virus that causes it, SARS-CoV-2, even in the pediatric population, especially in subsets that have pre-existing conditions, can be a very serious condition. Therefore, we are trying to reduce the risk of that serious condition by giving a vaccine. So there can be some side effects. Most of them are mild and manageable with over-the-counter medications, and even those are rare. But if those happen, you have to remember that a much bigger problem is being averted, which is COVID-19.
Dr. Sameer Gupta, let us talk a little about social responsibility and vaccines as well. We've seen in adults, and we've said time and again, that it is socially responsible to get yourself vaccinated. And now that the clearances come for vaccinating teens as well, shouldn't the same principles apply? And shouldn't parents go ahead and encourage their kids to get vaccinated, because they can be carriers of the virus too?
Absolutely. So, as one of the most important things that we can do to go back to normalcy, we've talked about this multiple times, Chetty, is vaccination, right? Vaccines are one of the biggest medical discoveries of all times. And vaccination has been there for almost 100 years in different ways, shapes, and forms. And children do get vaccinated. Now, the thing is that as children start going out, it's very difficult for them to wear masks. They may or may not listen, right? They may or may not agree with it, or they may take the mask out. And then they can become carriers for spreading infections to the adults at home, and vice versa too. Right now, children are at home, but the adults are working. They're going outside, and they're coming in and getting the vaccine. They're getting the infection to the house. So everybody has to take social responsibility and get vaccinated to prevent the other person in front of you from getting infected.
Right. Dr.
It's not,
Swapneil?
it's no one to be left behind, right? I mean, we've seen that,
Yes.
that the poorer countries across the world,
Yes.
in Africa, where the Omicron variant came out from, the WHO was saying that let's get everyone vaccinated.
Sure.
And that's why it's important to do that.
But Dr. Gupta, there have been many parents that I've been speaking to who say that, look, the indigenously built Covaxin is what we are administering kids right now at the moment. And there are many parents who go on to say, no, I will wait till the clearance comes for a Pfizer or a Moderna or something else. What would you like to tell them today? Let's re-establish that connection to Dr. Gupta. I'm taking the same question to Dr. Swapneil Parikh as well. Swapneil, how would you like to tell the parents who are a little hesitant when it comes to, one, vaccinating their children, B, vaccinating their children with Covaxin and are waiting for some miraculous other vaccines to come into India?
So those vaccines that you're waiting for, they're unlikely to come to India in any timeline that is likely to be acceptable. So there's no situation in which they're going to be available in time for the Omicron wave. So it makes sense to take the vaccine that's available right now. I always think about it as take an extra vaccine later if you want, rather than taking one less now. All the vaccines that most children in India have taken, to date, have been indigenous vaccines. They're vaccines manufactured in India. I understand the hesitancy. Perhaps there could have been a lot that was done better. Larger pediatric trials could have been conducted. They could have been done more transparently. But we have to understand that we are facing the threat of the virus. And there are subgroups in the pediatric population, especially those with pre-existing conditions, for whom COVID-19 can be a severe disease. So to protect especially those children, it's clear there's a benefit of vaccination. And even for the larger pediatric population that's eligible right now, the benefit of vaccination outweighs the risk. And COVID-19 is a risk even to those children.
Dr. Swapneil Parikh, there have been several myths floating around as far as vaccines are concerned ever since we began inoculating even adults, leave alone teens. The most common myth that I've been hearing is when you inject a dead virus into your system, probably you end up testing positive for COVID. That's been the most ludicrous one of them all. And the same applies to children as well, because those parents believe that that's exactly what happens. What would you like to tell them, and how would you like to scientifically explain that this is not true?
So, when we're testing for COVID-19, we're testing in the respiratory tract. We're taking an oral swab and a nasal swab. The vaccine that's being offered right now, it's a killed virus. It's an inactivated virus. It's not going to replicate in the body. It's not going to cause anyone to get COVID-19 or to get SARS-CoV-2 infection. However, when you go to a crowded vaccination center, sometimes what can happen is when people go to vaccination centers, there's crowding, there's poor social distancing. Many of these centers have poor ventilation. So at these centers, what can happen is you go to get the vaccine and at the center you get infected. And then people test positive because they got infected at the center, because they breathed in air that was exhaled by other people who are infected. So to reduce the risk of that, what you should do is use a high quality, high filtration mask, like an N95 or an FFP2 mask. These are available for pediatric use as well. Use these, try and maintain distance. Be really careful when you go for the vaccination. The vaccine isn't going to cause you to get infected, but if you don't follow the proper masking and social distancing protocols at the vaccine center, you can always get infected.
That's a fantastic point, Dr. Swapneil Parikh. Dr. Sameer Gupta, explain to our viewers today how transmissible is this Omicron variant? And in the light of that, what Swapneil Parikh just said, when you're going to the vaccination center, make sure that your teens are well protected, because it is not the vaccine that is going to have your child test positive, of course. That's a myth. It's actually the exposure at the vaccination center where socially they are not maintaining the right norms, distancing themselves, that can probably have your child catch the virus.
Exactly. So, the way I think we should just step back and understand how the vaccine works. When you give a dead virus, when you give a dead virus in an injection, and that's how multiple children vaccinations are given. It's not just this, multiple children vaccines are given in this form where a dead virus or a weakened virus, it's called a live attenuated virus, is given to you. And then your body understands it's a foreign organism and mounts an antibody response or soldier cells against it. Right? This is how multiple different vaccines are given. So this concept of the weakened virus or the dead virus is not new. It is how vaccines are created and how vaccines are given. And that antibody response, those soldier cells that come up to fight the foreign organism, is what you call antibodies. Okay. Now, this weakened virus, when you check for COVID or the SARS-CoV-2 virus, you take a swab and you put it in your nose, right? So it is a dead virus in the nose. It is the active virus in the nose, which you have inhaled from somewhere else, maybe from the vaccination center, maybe when you were taking when you were using public transportation to go to the vaccination center. That is how the virus has entered. It is not the dead virus which is making you test positive. So it's completely, they're two completely different and independent things. And when you go to the vaccination center, please do not take your mask down. I see multiple people who get the mask down at the vaccination center. They're getting the selfies taken. They're putting it up on social media. But this is how the infection can spread. That wear high quality masks, go to places which are nicely well ventilated, practice social distancing on the way to the vaccination center, at the vaccination center, and on the way back from the vaccination center.
Dr. Swapneil Parikh, can kids finally start going to school after getting vaccinated? And what is the recommended gap before a little bit of normalcy is resumed in their lives? Of course, schools will be largely dependent on what the administration has to say, but they've been for way too long confined in their homes.
There is absolutely no reason to avoid going to school because you aren't vaccinated. Schooling is absolutely essential for children. It's like breathing air, drinking water, eating food. Schooling is as essential as that for children. So ensure that your children do use the right kind of masks, follow the right protocols, but please ensure children are allowed to go to school. Don't wait till all children are vaccinated. Schooling is essential. We should not hold it up just for vaccination.
Also, Dr. Sameer Gupta, you're a new father. You have a newborn as well. Do you have any questions when it comes to the inoculation and clearances that should come in for the kids who are even below 15 years of age?
So right now the data that has come out is, the age group is 15 years and above. And my baby is only 6 months old. So right now we don't have any vaccinations for the 0 to 2 year age group. So, I think we're all looking forward to data coming out for that, for getting clearances for that specific subset. And, it's about time it's been almost 2 years since the pandemic started. So we're all looking forward to getting an approval from 0 to 100 years of age.
Absolutely. And how does one protect babies? Because babies are, of course, not getting vaccinated and only the approval is coming for 15 and above. Is there any way that the mothers can pass on the antibodies to the babies?
Yeah, so, breastfeeding becomes extremely important. It's one of the benefits of breastfeeding a baby is that the antibodies can go from the mother to the child. Breastfeeding is traditionally a big part of Indian culture, and we definitely encourage, and this, more so at this point than at any other point. So that's one thing, and the women and the mothers should certainly try and be at home as much as they can with the baby, and practice social distancing and good social hygiene when they go out. To prevent getting the infection that can then be transmitted to the child.
Right. Dr. Swapneil Parikh, once vaccinated for teens, how long does the immunity last in teens, and how long before the teens have to go ahead and get a second dose, and after the second dose too, how long they need to wait for their booster?
So right now, durability, so this is a 2-dose regimen even in children right now, spaced at 4 weeks. So the primary series consists of 2 doses for Covaxin. Right now, we don't have much data on the durability of Covaxin. Not even in adults, we don't have good data to show how long protection against various various degrees of COVID-19 lasts. We have very little data in the pediatric population. However, what we do know based on other vaccines and other diseases, having some amount of immunity is going to produce a memory response either from past infection or from the primary series. And that may, for a very long time, reduce the risk of severe disease somewhat. However, it's possible that after a certain period of time, it may wane and that there may be a booster required even in the pediatric population. This is currently an unanswered question. And in the weeks and months and years to come, we'll be able to provide definitive answers to this.
You know, that also begs a very big question, Dr. Gupta, that many parents I've been speaking to have been of the opinion that we do not know whether Covaxin ends up working on the Omicron variant or not. And there are several more mutations also within Corona. You hear about these mutations every day. But would you like to tell the viewers today and the parents today that Delta itself is not over and some level of protection is better than no protection at all as far as their teens are concerned?
Absolutely, this is exactly what I was also going to highlight, that when you're getting the infection, yes, we don't have enough data to say that a Covaxin in Omicron, yes or no, how much is the protection? But some vaccination is better than no vaccination, and you don't know what variant you are getting right now because we don't have enough genomic sequencing on the samples being done. So you don't know which variant you're going to get infected with. So do get the vaccine. There is absolutely no, Delta is not over. Omicron may be the dominant variant right now, but Delta is still hanging in there. So vaccination, Omicron, Delta, doesn't matter. Do get vaccinated. And when we try and extrapolate data of vaccinations, whether it's the Pfizer vaccine, the AstraZeneca vaccine, there is protection against the Omicron variant also. There is definite protection against the Omicron variant also. So yes, there is going to be some protection with the Omicron variant. There is definitely going to be a lot of protection against the Delta variant and the Alpha variant and the Beta variant and the other variants.
Sure. And before we wind up, Swapneil Parikh, one last word from you. Your words of encouragement for all the teens out there who are making a beeline to get themselves vaccinated, and the parents as well. Some words of inspiration, encouragement to help them go ahead, get their jab for the ones who are also a little hesitant.
For teens who are getting vaccinated right now, vaccination is nothing new to you. You'll have had so many vaccines to build up immunity, to protect you against infectious diseases. This is just one more vaccine that's going to protect you from a very, very serious, potentially a very, very serious disease. In some children, this can be very, very serious, especially those who have pre-existing conditions. And it's important to remember that vaccines are our greatest public health intervention and humanity's greatest invention. They've saved more lives than anything else. So do take the opportunity when you are eligible to go and get vaccinated. And we'll all be a little safer because of it.
All right. Thank you on that note, Dr. Swapneil Parikh, Dr. Sameer Gupta. Very, very informative inputs right there. I'm hoping all the kids, teens and the parents listening benefit from this broadcast, and hope all your frequently asked questions have been answered by these two top doctors that you see on your screens right now. That's it from me, Chaiti Narula. I'm slipping into a very short commercial break. Lots more coming up on the other side.